Hi, my name is John Kairouz, and it's an honor, privilege, and pleasure to have the opportunity to speak to all of you today at the Stay Safe COVID-19 Virtual Awareness Campaign. For today, as a start off, I'd like to talk about a very important topic called rebooting your teams during the post-COVID era. And to just illustrate a little bit about who I am and what I basically do. So I'm a neurointegrative coach. My background is in neuroscience and a little bit of neuropsychology and neurobiology. I've been researching these fields for about 20 years now. And I'd like to discuss how neuroscience, neuropsychology, neurobiology can be integrated into the organizational structure of organizations, whether you're governmental, whether you're a private business, or whether you're a nonprofit, and how it affects our brains and our performance and behavior when we're dealing with a COVID-19 reality. So starting off with the next slide, I'd like to introduce and talk a little bit about how organizations respond to a crisis in general. So one of the first things that tends to happen is we first react to a situation. And when we get hit with a crisis, we try to think of the best responses that we can to make sense of that crisis. And so we're really in a reactive phase here, reacting to the crisis itself. As a second stage, what happens is we start to recover from that crisis. And this is really where we are today. In this stage, we generally are in the learning stage. So we've learned what works and what doesn't work. We're starting to become more comfortable with the reality that we're in. And we're starting to digest the new conditions and mapping out a new reality or a new set of options on how to deal with COVID in general. In the third stage, which we'll hopefully get to soon, maybe at the end of this year, we'll start to rise above the challenges that COVID is actually creating for us. And in this stage, we'll have systems, methods, metrics, procedures, really managing the impact environmentally, biologically, and if you want, economically and socially of COVID on our reality and on our community. So moving forward, from an organizational perspective, which is slightly a big picture, we'd like to go a little bit more focused into how the human brain itself responds to a crisis. So how do people deal with situations like this? And in general, the science says that we first filter our situation when we're hit with such a challenge. And when we say filter, under an intense amount of pressure, our brain tends to kick out all the information that is not necessary or not vital and focus completely on what we think is necessary, vital, and comfortable to us. So what is essential to our survival? Now, the plus side of this is that we're focusing on what's important. The downside of this is we tend to focus on what we're used to. So that's why you kind of noticed probably during that time when we first got hit with the COVID challenge, a lot of people started circulating a lot of WhatsApp messages, and a lot of that news was fake. Even the media itself didn't really know what information to share. And there's a lot of loss of information and a lack of qualitative and quantitative information. So how do we deal with that? The first thing that we can do is we can lead by example. And leading by example means we make it easy and simple for the people that we lead and work with to follow us by setting the right example. So we really need to be well informed. We need to have the facts and figures and information that allows us to lead by example. The second problem that we get hit with at the level of our brain is we tend to stick to what's familiar. So during a crisis, you'll notice sometimes elderly people, you invite them to leave their home and they're not ready to do that because they believe their home is a safer choice. In reality, our old habits and our old decisions are not a safer choice with the COVID reality that we're in today, neither economically, nor biologically, nor socially. So this can cause some conflict in the brain, and the brain doesn't like a VUCA world, which is volatility, uncertainty, complexity, and this situation tends to require us to find a better way to empower people to make better choices. So what the brain is really looking for here is credibility. It's looking for a source of information that is more credible than its own preferences internally. And in this situation, if we can build that credibility with the people around us, as doctors, as social workers, as government organizations, as leaders of businesses, parents, family members, members of the community, by building credibility, by offering valuable information, we can support and assist our community to make better choices moving forward that are educated, more knowledgeable, and more fact-based. The third thing that we tend to do at the level of our brain when we're hit with a crisis is we scan for confirmation. So we tend to look around and see what other people are doing, and we kind of copy paste them because it feels more, it has a higher chance of success than actually, trying to rely on ourselves alone. So in this situation, one of the ways that you can deal with that is to be consistent, because consistent is concrete for the brain. Repetition is key. And so in this situation, when we deliver clear, consistent messages repetitively as, let's say, a hospital or a medical organization or a government organization communicating clearly to the public about what is a fact and what is not a fact, this gives a lot more certainty to the brain and allows us and empowers us to make better choices, both with ourselves and the community. And I think now we're facing a challenge where there is a chunk of the population in the world which believes that COVID isn't even there. And they're under this illusion that COVID is a lie or a conspiracy theory. And even though there might be some conspiracies taking place that are riding on top of the COVID wave, in reality, COVID is very much a critical virus that has the ability to impact our community negatively, both health-wise and economically and socially and mentally and hope-wise. So it's very, very important that we really know what we're doing and deal with it maturely and responsibly. The fourth part is we believe what comes first. So for some reason, the brain tends to look at what comes first. And one of the reasons for that is herd behavior. If you look here, you'll see this a buffalo which felt spooked by a sound and ran immediately into the river, running away from the threat of perceived danger, perceived being not necessarily true. And so all the other buffaloes don't even wait to think, they just run with them, and then later they will check to see if that is true. And that tends to happen both at a human level. And so how do we deal with this? We deal with this ultimately by really being reliable, by making sure that we are the go-to source for stability, reliability, and credibility, maybe creating a task force within your organization that empowers your people and gives them the power to look forward to hearing from you and rely on you as a resource. So these are some of the ways that the brain interacts with a crisis, and COVID is a crisis. What are the things that you could do as an organization, as a member of your organization, to be productive? Well, for the sake of thinking about it from a coaching perspective, we can ask ourselves some questions. So what I've done here is illustrate 4 simple steps. 1, our thoughts. 2, our actions. 3, what resources we need to take those actions forward. And 4, what are the possible outcomes of these actions, and are they what we want? So starting off with 1, how can we lead by example? So how can we really lead by example in the way that things should be done based on the knowledge and facts and figures that we have, qualitative data, not just quantitative and qualitative data. 2, how can we be more credible? How can we communicate credibility and trust and respect to the members of our community and our team? 3, how can we be consistent and ensure that they find that we are always a reliable resource for information and good choices and good management of critical crisis situations? And 4, finally, how can we be reliable? How can they feel that we'll definitely be there for them no matter what's happening? So these are some powerful questions to ask that empower us to do a better job at serving our community and our organizations, and ultimately making the world a better place for ourselves, our family, and those around us. Finally, I'd like to talk about rebooting your teams through neuro coaching. Now, neurointegrative coaching is a very powerful tool. And ultimately, if it's applied from a certified specialist, that's definitely going to create fantastic results. One of the things we could think about is remembering that at the level of the brain, emotion underlies the formation of memory. So what that means is, every time we go through a powerful emotional experience, the amygdala in our brain plays a role of leading our brain to emotional arousal. And that mediates certain neurotransmitters which are essential for memory consolidation. So in this situation, the more we arouse emotions, the more we have the capacity to modulate the strength and depth of storage of memory. And so in this situation, I think it's important to remember, and this is the recommended tactics that you have in each one of these slides, to communicate an evolved purpose and engage a deeper meaning and activate emotional engagement from your team. So what does that mean? If your mission statement as an organization, as a hospital, as a medical establishment, as a government, as a nonprofit, as a community is strong and powerful, has been revised to relate to the challenges and situation that we're in the recovery period of COVID-19 and moving to a fruitful period, hopefully in the future, then it should impact people and essentially move them towards action. So the more you impact them with powerful, clear, and effective messages, the more they're likely to remember the lessons you're trying to communicate to them, and ultimately that empowers them to do the same to others. So having a powerful story to share from you to them and them to others, and ultimately that should lead to a much better environment. The second part is that relationships are a foundation for change. And really, as we go through critical periods in our life, especially like COVID is offering, it's important to remember that we are empowered by the community that supports us. So here we have the power to take advantage of our relationships, build stronger teams so that we can enhance the way we do business or the way we operate in general. Maybe it's time to revise your mission, values, vision, and kind of think about how that could impact your team by creating a safe space, a space of reflection for them so they can grow. So maybe you might want to take advantage of the digital tools that are available, set up Zoom calls or Microsoft Team calls, invite your team members to actually express what they're really fearing, what they're really feeling, what they're really thinking about, where they have question marks, what areas are gray for them and are unclear, and so that we support them in venting out and expressing what their concerns are. One, that gives us the ability to really learn what's happening to the internal client, the client and member of our organization. And two, at the same time, it supports us in understanding what information we need to communicate to be effective in empowering our team. The third thing we should remember, if you'd like, and I invite you to remember, in fact, is that experience rewires the brain. So every time we go through a specific experience, it rewires the way our brain is wired. And this is kind of due to the amygdala and hippocampus, because they are very elastic parts of our brain and they're due to learn from new experiences, especially if they're emotionally charged experiences. So here a recommended tactic would be to reflect on what works in general within our organization, what maybe needs to be changed, and maybe what needs to be dropped. So there might be some processes that are still in play that no longer apply, are no longer efficient or effective, and truly could be upgraded and redesigned. To recommit again to communicating and ensuring the well-being of our employees and the team members and our member of our community, because when you take care of your people, they take care of each other, they take care of you, and they take care of the end client. Rethink the work environment. A lot of people say working from home. Maybe it's about flexibility in working, so choosing a different environment to get work done, and then re-engaging the world through a new model of experience. Because really, in 2020, I guess one of the biggest words that you hear in organizations worldwide is experience management or experience design. So it might be interesting to think about what type of experience do we want our people to go through. And it doesn't require investment. Experience requires rethinking and re-engineering the steps that we've put in place and the processes or the type of empowerment we give our people. Another beautiful fact about the brain is that we can leverage the nature and nurture of the brains of our team members. And what that means is, it's not just about genetic environment or genetics, it's also about the way we empower or program the brain. So a recommended tactic here would be to coach your team or assign coaches to your team members. And this will help them by building awareness, using creative tools to empower and accelerate them towards action, because what's needed now is action. And finally, to train and enhance their capacity. So we could upskill them, enhance their capacity, empower the skills we do need in today's world, and drive high quality results. And that way, ultimately, you'll need to invest less and you'll get a lot more from the team members that currently are part of your organization. The last thing I'd like to share for today, and I really thank you for your time, is that success fuels success neurologically. The brain is wired to reward you when you have success. So in a situation like this, with the potential of another lockdown or shutdown, or all the challenges that we face, or working digitally from home, which started off slow, but now is people are spending a lot of time in their work environment at home, maybe working even longer hours than before as they adapt to the digital world and as we learn to become more efficient. It might be important to empower your team, to give them the right and the power to make better decisions. And two, to really think about what tools to use to empower them. So if I give my team the right technological tools to succeed at doing their job and meeting their KPIs and finishing their tasks, then that's going to make them more motivated to continue to do that. And if I empower them and I give them the freedom and space to think creatively in finding solutions, that's also going to empower them and allow you to have a lot less work on yourself as a leader or as an executive, and really handing over the reins to your team to really shine and bring about the highest level of value. So this has really been a little talk, just a small introduction. If you feel like connecting with me, it would be my absolute pleasure. I'm available on LinkedIn under this spelling, John Kairouz, on Instagram, YouTube, Facebook, and you have access to my phone number. Ultimately, what I would really like to do is work with you in order to customize a solution that makes the best sense so that we can move forward as an organization, as a community, and as a country when we're facing the challenges that COVID-19 is presenting us. Considering that we have so many other challenges, at least if we can get one moving on the right path, then I think we can learn from that and then replicate those learnings across the board. Thank you so much. It's been an honor and a privilege. I wish you all the best, and remember, stay safe.